G'day there, Chris from the Headache and Pain Management Centre, and today we're talking about the number one biggest mistake as it comes to most health professionals' treatment. It's a little bit controversial, but if you listen along to the end, you'll understand exactly what you need to do for your chronic pain, your chronic health condition, to make sure that you get the best result. Okay, without further ado, what is the number one biggest mistake? It is not having an adaptive treatment plan. An adaptive treatment plan. What is an adaptive treatment plan? Well, first of all, you should have, no matter where you go, whether it's your doctor, your health professional, or whatever, they should be telling you what they think needs to happen over the next little while to change your health condition to get the best outcome for you. So that should be a treatment plan. There should be a plan in place to tell you how things should work, what should happen, what you need to do to get the best results for you. However, what often is missed if there is a treatment plan is that it is not adaptive. Okay, so as we know, when we're looking at any sort of bit of data, if we're testing any idea, often things don't quite go to plan sometimes, okay? So no matter what we try to do, no matter what someone or intervention tries to be, attempted, is that what happens is that it doesn't quite go the way we plan. We might want to think that the neck would get better when we do this, or the back would get better when we do this, but for whatever reason, it flares up or it gets a little bit worse. Now, this isn't a time to panic as a patient, even though it feels like that it might, it might have made things worse, things might have got more broken, but in fact, what it might actually do is tell a little bit more about what is going on with the symptom set or with the condition that you have. So the way that we work things here, okay, and this has been sort of trialed and tested over the last 8 years of being here in the clinic, is that we don't actually sort of go about saying, okay, this is exactly what's going to happen. We promise, we guarantee that this is what is going to roll. Okay, you can't do that when we're talking about something as complex as chronic pain. What we do is we have a system in place where we do this, where we formulate an idea about what might be happening and explain that to you so that you have a very clear understanding of where we're coming from. Then what we do is that we test and measure. We test and measure. We test and measure. What do I mean by this? What we mean is that we test an element of treatment at a very conservative level to test what the outcome is, okay? To test whether things get better, if they stay the same, or if they get, God forbid, if they flare up or if they get worse, okay? Now, the reason why we treat conservatively, because being a chronic pain sufferer, a chronic migraine sufferer, is that sometimes it doesn't take a lot to stir things up if you do things in just the wrong way. Having seen a lot of patients over the years in a chronic pain setting here in the clinic, we do know that flare-ups sometimes can happen. So it's really, really important on day one just to dip the toe in, just to test something very, very small to reduce that risk of flaring up. And if things are going well, then we add more, and then we add more, and then we add more to get the result that you want to get. In essence, what should happen is that your physiotherapist should be able to predict what's going to happen next. Okay, so the physio should be able to say, right, if things are getting better, this is what I expect to see. If we're right, this is what we expect to see. If we're on the right track, but we need to do a little bit more, then perhaps your symptoms might change a little bit, or it might not change much because we didn't either do enough or didn't go hard enough to get the result that you need early on. If we're wrong, if things are changed for the negative, say if the headache goes from the left side to the right side, if the back pain moves from your leg into your back or something like that, then that gives us a bit of an idea of what's really happening in the tissues. Really what's happening is that you're using the first couple of sessions of treatment to really knuckle down what the diagnosis is for your problem, because there's no point actually working out what the treatment needs to be long term until we get the diagnosis right early on. And the early part of treatment is actually all about confirming what the diagnosis is and getting some quick wins to get you back moving as fast as we can. So what should an adaptive treatment plan actually have there for you? So at the beginning of your treatment, what should happen with any physio that you see, and this is what we do here at the clinic, is that it should tell you what the diagnosis is, or what the physiotherapist or health professional believes the diagnosis is or should be. Okay, so is it a stiff joint? Is it a stiff muscle? Is it a sensitized nervous system? Is it something else? You need to be very clear on that from day one as to what your health professional is thinking, and you should ask questions about that. Then what the physiotherapist or health professional should tell you is how long they believe it will take to improve and get better, okay? Here's a bit of a cheat note for you, all right? If it's a strength type program, it's gonna take 12 weeks, okay? It takes 12 weeks for muscles to actually grow to a point where there is actual tangible change. It takes 6 weeks for muscles to start working and 6 weeks for the muscles to grow. So if it's anything less than 12 weeks and there's a strength component to it, they're probably kidding themselves a little bit, and that's pretty much just the facts. 12 weeks for a muscle, so that's kind of around where you need to be thinking of if you've got a chronic pain condition, around that 12-week mark. Okay. What your physio should also tell you is what's happening in the clinic when the physio is there with you or health professionals with you, and also what is expected of you when you're at home as well. So what exercises you need to complete in your own time to get the results that you need. So that's really, really important to know that in your treatment plan within the first couple of sessions once the diagnosis is knuckled down. But of course, there's one thing that's actually the most important when it comes to getting an adaptive treatment plan and it working out the best thing for you, okay? Now, this is often difficult to hear for people, but it actually comes down to you. It comes down to you and your motivation to change something. Okay, so you need to be willing to change a few things in your lifestyle, change a few things into your routine to actually make things improve over time. A couple of small exercises, maybe getting out and having a walk, maybe actually getting your stress levels finally under control. This is things that you need to do to give yourself the best result. But you can't do it unless you're motivated to change, unless you're ready to actually take those steps to get the results that you want. Now, things that can actually help you to motivate to change, okay, is to ask questions of your health professional about what it is that their idea is. You need to have trust and faith in your health professional. Otherwise, quite frankly, you're just not going to carry out the exercises. You won't be trusting them, you won't be motivated to do it. So you need to understand where your health professional is coming from in terms of the diagnosis and wrap your head around what is actually happening with your condition. The second thing is actually to accept the advice that you're being given, okay? So health professionals do know what they're talking about most of the time. They do know what they're talking about when it comes to chronic pain, when they know what they're doing, okay? So you need to ask the questions, you need to accept the advice that you're being given by a health professional, and at the very least, test and measure what is going on. The only way that you can know if anything is happening or going well or going right is to accept the advice, test what the advice is, and measure what the result is. If you're measuring the result and it's not going so well, then perhaps it's time to get a second opinion or to try a different plan. So the second thing is to accept that advice. And the third is to adopt the strategies long term, okay? If things are working well for you, put them into your routine, put them into your weekly routine, your daily routine, so that you're able to actually continue that long-term improvement and to keep those improvements that you actually have gained from doing all of that hard work. We want to make sure that when we're sorting out your headache, sorting out your neck pain, sorting out your back pain, your chronic pain, that we're giving you the long-term management strategies to get you the best result long-term. So if anything does ever come up again, you know what to do. You know what you need to do. You can get your battle plan out, get your treatment plan out again, and just follow the steps that you've previously done before. I hope that's been really helpful. An adaptive treatment plan is what you need to get the best result for your chronic pain. It is patient-centered practice, it's evidence-based practice, it's what needs to happen for conditions just like yours. If there's any questions, please type in below, please get in touch, and more than happy to discuss any element of how we develop an adaptive treatment plan just for you. I hope that's been really helpful. We'll see you again next time. Cheers and bye for now.